I do think that. So just to clarify, this was a trial which randomized patients to either pembrolizumab or brentuximab vedotin for patients with relapsed or refractory disease. And so up until this point, brentuximab had been an indication, and pembrolizumab was approved, but indicated in a later setting. So this is the first head-to-head comparison of efficacy and durability of response for these two drugs. And so I think that the takeaway from this particular trial is that clinicians will be utilizing pembrolizumab earlier in the treatment of relapsed classical Hodgkin lymphoma. The important thing about this trial is to mention that patients were stratified for prior autologous stem cell transplant. Many of the patients had a prior transplant, and they were also stratified for whether or not they had primary refractory disease or whether they had relapsed greater than or less than 12 months after their initial therapy. So there were a variety of responses, a variety of tumor behaviors, I would say, that were accounted for in this trial, and the arms were well balanced in all of those parameters. So the overall response rate was 65.6% for pembrolizumab as opposed to 54% for brentuximab, and the complete remission response rate was fairly similar between the two. So overall, looking at progression-free survival as well as overall survival, as well as duration of response, pembrolizumab came out better than brentuximab vedotin. In terms of adverse effects, we already know the main side effects that are anticipated for both drugs, and so brentuximab vedotin is well known for its neuropathy, which can become a problem and often requires dose adjustments or discontinuation of therapy. Pembrolizumab is more known for autoimmune side effects. So overall, the duration of response was over 20 months for pembrolizumab as opposed to almost 14 months for brentuximab vedotin. We don't think that either of these interventions are going to be curative for these patients with relapsed classical Hodgkin lymphoma, but knowing which is more likely to provide the best response in this setting helps us decide which to pick first.